I'd like to talk today about accessibility to mental health support within the East Riding. Prior to the pandemic, we've already seen instances of anxiety and depression increase within our East Riding community and nationally. Coming out of the pandemic and following bouts of social isolation, loneliness, and people not being able to see their loved ones do the things they love the most, like being outdoors and being active, we've seen further increases in anxiety and depression and low level mental health needs. We see people not accessing mental health support at the right time, instead going in at a crisis point or not at all. We need to encourage people to access mental health support earlier and seek the support that they need. We're lucky in the East Riding to have the East Riding Healthy Minds campaign, a campaign designed jointly by professionals and people with lived experience to highlight the need to look after your mental health and well-being, to highlight things like training, volunteering and other mental health support services that are out there. With more time, resource and money, we can make this the number one place for people to go to access their mental health needs. A life is lost through suicide every 2 hours in the UK, and it is estimated that 135 people are exposed to a single suicide, with 1 in 5 reporting that this experience had a devastating impact in their lives or caused a major life disruption. Suicide is something that can affect us all at any point in our lives. It is everybody's business to be aware of those around us, especially those who are at risk. Suicide is preventable, and with the right intervention and know-how, anybody can have a conversation at any time which could save a life. You never know when that could be or who that could be with, potentially with a family member, a friend, a neighbour, a work colleague, or even a stranger you've never met before. Prioritising things like suicide prevention training in order to give everyone the tools, skills and confidence to approach the subject of suicide can save lives. Raising community awareness through suicide prevention training will also help break down the stigma and taboo which surrounds suicide, and is important to make progress in preventing suicide.
Social prescribing. This was recently recommissioned and used learning from the pandemic to increase its presence within the community groups and offered alternative contact methods. It uses conversations to get to the cause of the issues, not just the symptoms, and wherever possible it links residents to local services and assets to help them in addressing their issues. It works with the Active Communities team and Smile to support communities to build and develop local services. However, these are not equitable across all localities. For us, it can act as a thermometer of need within the communities through its regular contact with residents and detailed monthly reporting, which helps us to identify spikes and trends relatively quickly.
Health protection has been at the forefront of public health since the emergence of COVID-19. As we move towards living with COVID in the East Riding, the Council's public health team wants to continue to raise the profile of health protection. To enable this, we need to continue to develop the skill set of colleagues, we need to progress our surveillance and monitoring measures, and we need to strengthen our current relationships locally, regionally and nationally. Driving forward with these aims will allow the East Riding of Yorkshire Council to become a trailblazer in the region and protect the health, including the health of those most vulnerable, at the earliest possible point, helping the Council work towards one of its key priorities, protecting the vulnerable. Effective management of infectious diseases require timely and effective action. In the East Riding, our proactive and reactive planning has meant many outbreaks have been dealt with effectively. COVID-19 was an ideal environment to finesse our skills, and now we must work beyond this. Today, we are continuing our intensive support to sectors that need it the most, such as education and adult social care, through our dedicated and newly appointed roles. Interventions like this must continue as well as expand. Next steps need to focus on communication and education to the public so management of such infections can be achieved and easily accessible by all. Work will also need to concentrate on reframing the management of infectious diseases through screening, immunisations and symptom checking.
Social isolation and loneliness. This can affect anyone, even those who are regularly surrounded by others. It can affect any age, gender, social position or income level. Recent national research conducted over a 7-year period with over 35,000 people aged 16 and above concluded young and disabled people and those with long-term health conditions are disproportionately affected. Young and disabled people in the LGBTQ community are at higher risk of experiencing chronic loneliness. There is a cyclic link between chronic loneliness and the onset and continuation of mental health distress. It can be significantly compounded by other life course changes and become the norm or habit for some people, particularly following the restrictions of the pandemic. Often those experiencing it are reluctant to access health and care services until absolutely necessary, thus further impacting their health and well-being.
In the East Riding of Yorkshire, we have an ageing population compared to the national average, which connects to a higher than average dementia prevalence. The COVID-19 pandemic involved shielding of vulnerable people, causing a reduction in those coming forward for a diagnosis. Improving diagnosis rates begins with promoting clear information about symptoms and the importance of diagnosis. Information on how to access this through the GP and memory assessment service. It is important that people are supported pre, during and post-diagnosis so that they can live as well as they can with the condition. Learning you have dementia can be a shock and socially isolating, so there needs to be good reasons to have this confirmed, which is created by ensuring ongoing investment in dementia advisors, peer support, relationship support, specialist carer support, dementia-friendly communities, and co-produced approaches where people with dementia influence and are involved with strategy, policy and delivery of support. Raising awareness, information and support are the key factors.
Serious incidents like suicides, child deaths and drug overdoses, both fatal and non-fatal, cause irreparable damage to people, their families and the wider society that they touch. As an example, the East Riding has a significantly higher rate of suicides than the England average. Deaths don't only affect the victim, but they severely negatively impact the mental health of bereaved family and friends and can even lead to further deaths. Catching incidents like these before they can occur spares health and financial burdens, but we cannot prevent without knowing what is happening in the first place, and this is where serious incident surveillance comes in. Through it, we can monitor, understand, and then learn from serious events. If we, along with our partners, use this learning to inform decisions, policy, and best practice, we can strive to prevent such incidents ever happening again.